Have you ever wondered what Crohn's disease is and how it affects the human body? Crohn's disease, named after Dr. Burrell B. Crohn, who first described the condition in the early 20th century, is a chronic inflammatory bowel disease. It affects the digestive tract and can cause symptoms ranging from mild to severe. Let's imagine our digestive system as a long, winding river, and Crohn's disease as a storm that can stir up trouble anywhere along this river. It can cause inflammation in any part of the digestive tract, from the mouth all the way to the anus, but it most commonly affects the end of the small intestine and the beginning of the colon. What does this storm look like? Well, symptoms can vary widely, but some of the most common ones include abdominal pain, diarrhea, weight loss, and fatigue. The severity of these symptoms can fluctuate over time, leading to periods of intense discomfort followed by periods of relative calm, much like the weather patterns of a storm. But what causes this storm to brew in the first place? The exact cause of Crohn's disease isn't fully understood, but it's believed to be a complex interplay of genetic, environmental, and immune system factors. Simply put, in some people, the immune system mistakenly attacks the healthy cells in the digestive tract, causing inflammation. Living with Crohn's disease can be challenging. It can impact a person's physical health, daily routine, and quality of life. It can make planning day-to-day activities difficult due to the unpredictability of symptoms. However, with the right treatment and management, people with Crohn's disease can lead fulfilling lives. Now that we have a basic understanding of Crohn's disease, let's delve into the role of biomarkers in its management. You might be asking, what exactly are biomarkers and why are they important? Well, let's delve into that. Imagine your body is like a vast, bustling city. Everything is running smoothly, but occasionally, something goes awry. Now, how would you know if there's an issue? You would rely on signals or flags, right? In the grand city of your body, biomarkers serve as these crucial signals. They are molecules that can be measured in body fluids like blood or urine or tissues that indicate normal or abnormal processes or conditions or diseases. Think of them as clues in a detective story. Just as a detective uses clues to solve a mystery, doctors use biomarkers to detect, diagnose, and manage diseases. These clues, or biomarkers, can tell us if a disease is present, if it's progressing, or if it's responding to treatment. To understand their importance, let's consider a practical example. When you have a fever, your body temperature rises, right? That's a biomarker. It's a measurable change indicating that your body is fighting an infection. But biomarkers aren't just about diagnosing diseases. They're also key players in treatment decisions. Let's go back to our fever example. If you have a high temperature, you might take a fever reducer. If your temperature goes down, that's a signal the medicine is working. So, biomarkers not only help identify the problem, they also guide us on the path to resolution. In the field of medicine, biomarkers have revolutionized the way we approach diagnosis and treatment. They help doctors to personalize treatments, making them more effective and reducing side effects. They also contribute to the development of new therapeutic strategies, paving the way for breakthroughs in disease management. So, to sum it up, biomarkers are like the body's messengers, sending signals about what's happening inside our bodies. They are indispensable tools in modern medicine, playing a crucial role in diagnosing, treating, and managing various diseases. With this understanding of biomarkers, we can now explore their role in managing Crohn's disease. So, how do biomarkers play a role in managing Crohn's disease? Before we dive in, let's remind ourselves that Crohn's disease is an inflammatory bowel disease. It can cause inflammation in any part of the digestive tract, leading to a variety of symptoms that can be quite severe. The exact cause of Crohn's disease is still unknown, and that's where biomarkers come into the picture. The AGA, or the American Gastroenterological Association, has released clinical practice guidelines that affirm the role of biomarkers in managing Crohn's disease. But what does that mean? It simply means that these guidelines recognize biomarkers as valuable tools in the management of this disease. Biomarkers are substances that are found in the body and can be measured, which gives us an indication of a biological condition or state. In the case of Crohn's disease, these biomarkers can help in several ways. They can aid in diagnosing the disease, for starters. Certain biomarkers are more prevalent in people with Crohn's disease. By measuring these biomarkers, healthcare providers can get a clearer picture of what's going on inside the patient's body. Biomarkers are also invaluable in monitoring disease progression. They can show us how the disease is evolving over time, which can help doctors adjust treatment plans as necessary. Then there's the role of biomarkers in evaluating how well a person is responding to treatment. This is crucial because it can help determine whether a treatment is effective or if a change in strategy is needed. For example, a decrease in certain biomarkers may indicate that the inflammation is lessening, which would suggest that the treatment is working. On the other hand, if these biomarkers remain high or increase, it might mean that the treatment isn't as effective as hoped. This ability to assess treatment response can lead to more personalized care. Instead of a one-size-fits-all approach, doctors can use these biomarkers to tailor treatment plans to the individual needs of the patient. Biomarkers have a significant role in managing Crohn's disease, but let's also consider the potential challenges in their use. While biomarkers present an exciting avenue for managing Crohn's disease, there are also challenges to consider. What might these be? Biomarkers are no doubt revolutionizing the way we approach Crohn's disease. However, like any emerging field, it's not without its hurdles. For one, there's the issue of variability in results. Biomarkers can vary from patient to patient, and even within the same patient over time. This makes it hard to establish a one-size-fits-all approach to treatment. Cost is another significant challenge. Biomarker testing can be expensive, and not all insurance companies cover it. This can limit access to this valuable diagnostic tool, particularly for patients in lower-income brackets. Speaking of access, it's not just about the financial aspect. There's also the question of geographical accessibility. Not all healthcare facilities, especially those in rural or underserved areas, have the necessary equipment or trained personnel to conduct these tests. This means patients might have to travel long distances to get tested, adding yet another layer of complexity to their disease management. Then, there's the need for further research and validation. While the role of biomarkers in Crohn's disease is increasingly recognized, we're still in the early stages of understanding. More studies are needed to validate the effectiveness of different biomarkers, to understand how they interact with each other and the disease, and to determine the best ways to use them in clinical practice. And lastly, we must consider the ethical implications. Biomarkers can provide a lot of information about a person's health, which, if mishandled, could lead to privacy concerns. Safeguards must be in place to ensure patient data is handled with the utmost care and confidentiality. Despite these challenges, the use of biomarkers in managing Crohn's disease holds great promise for improving patient outcomes. As we navigate these obstacles and continue to learn, we move a step closer every day to a future where Crohn's disease can be managed more effectively and perhaps one day even cured. So, what have we learned today about Crohn's disease and biomarkers? We've delved into the complexities of Crohn's disease, a chronic inflammatory condition of the gastrointestinal tract, and the critical role that biomarkers play in its management. We've discovered that these biological indicators offer valuable insights into disease activity, severity, and response to treatment. We've also discussed how biomarkers can predict the course of the disease and help tailor personalized treatment plans. However, the journey isn't without its hurdles. We've touched upon the challenges encountered in using biomarkers, such as the need for more extensive validation studies and the quest for more specific and sensitive biomarkers. Despite these obstacles, the potential of biomarkers in revolutionizing Crohn's disease management cannot be understated. The journey is ongoing, and every step forward is a victory. As we continue to explore and understand these complex concepts, we move closer to improving the lives of those living with Crohn's disease.